Hi there, it's Dr. David Green, founder and CEO of R3 Stem Cell, the world's largest regenerative cell therapy providers. Today, the topic is, let me read this, it's from a patient. How do you ensure the prevention of disease transmission from donors during stem cell therapy? Well, it's a little bit complicated in how we do it. And the reason is because regulatory agencies tell us how to do it. So not only do we follow what they tell us to do, we go above and beyond. So before a donor donates, before they have their scheduled C-section procedure, they go through a questionnaire. And that's the beauty of it being a scheduled C-section, is that we pretty much know when it's going to happen, so we can do the consent and give the questionnaire to the donor. It's 210 questions. Everything from do you have a history of vaping or smoking, to opioid abuse, recent travel history, tattoos, because there's some places and time frames you get tattooed, there could be some underlying potential for disease, things like that, family history, cancers, whatnot. Now, that's step one. If the answers to all of those are acceptable, then when our accredited donor agency gets the tissue, they will then send it off for various tests, such as, and I'm going to read this, CMV, hepatitis, various hepatitis surface antigens, HIV, HTLV, syphilis, and West Nile virus. Now, after the tissue is processed at the lab, then there's a whole nother series of tests. Multiple vials, anywhere from 10 to 30 of the product, get sent to a third party. And that third party will test it for 14 days for bacteria, virus, fungus, and endotoxin. Okay? Now, when all those tests come back, it takes 2 weeks. Then we'll get to see if everything's negative or if something, is positive. If anything is positive, our lab has to throw all of the stem cells away. It's all or nothing, okay? We want to make no mistakes when it comes to patient safety. And that's paid off for us very nicely over the last 12 years. We've never had, let me knock on some wood here, we've never had a deep infection, we've never had a disease transmission, we've never had a rejection of the stem cells. So it's been a very, very safe procedure for patients. And I take a lot of pride in that, right? Because you definitely want to help as many people as possible, but also not, to harm anyone. So all of our, the lots that come from the lab have this certificate of analysis. Patients are welcome to see it, whether it's from a lab here in the United States or the lab in Mexico or Pakistan or other countries. The medical director of the lab reviews the donor history and all of the testing that comes back to make sure that it's safe for patient use. The international ones also have additional things like, one of them even has the sex of the baby where the C-section was done, that we got the umbilical cord. We also check viability of cells, look for mutations, things like that if we're culturing. This is not a cultured tissue, okay? But that's perfectly available for every patient who wants to see it, because everything needs to be transparent with patients. We want them to feel very comfortable with the procedures that they're getting. We do more than any other centers globally. We've done 24,000 in the last 10 years. So safety is paramount, right up there with the outcomes that you're getting. Okay? So we take it ridiculously seriously, and we want that to be portrayed in the outcomes that are done safely, achieved safely for you. Visit us online at r3stemcell.com. Click over to our YouTube channel. We have over 500 videos of educational information and patient success stories. And then call us to get your free consultation today at +1-844-GET-STEM. Thank you.